Cultural context profoundly shapes how trauma is perceived, expressed, and healed. Cultural norms also dictate what is even considered traumatic and how symptoms might be displayed. For some, psychological distress is manifested emotionally, physically, and for some as a spiritual crisis of faith. Intergenerational trauma and historical wounds are often experienced as collective trauma passed down through generations. And even within a community itself, there can be a violation of trust within that community that leads to psychological harm. The role of all clinicians, whether physicians, therapists, alternative healers, is to acknowledge our own bias and to learn how to understand a client's cultural background, to build trust, and to help traumatized women heal and avoid contributing to more trauma and systemic marginalization. Welcome to Gyno Curious. I'm your host and creator, Dr. Amy Novat. From both sides of the speculum, we're here to investigate what it means to be a healer and to be healed. Please follow, share, and like the show wherever you're getting your podcasts. And please, if you're interested in my clinical practice, please go to dramynovat.com. I want to welcome Dr. Manisha Dayal today to the show. Dr. Dayal is a licensed clinical psychologist in private practice in Chicago. She graduated in 1996 with her doctorate in clinical psychology and has dedicated her career towards trauma-informed care, particularly in the area of childhood sexual abuse, intimate partner violence, and developmental, racial, emotional, and physical trauma. Dr. Dayal is particularly interested in how the body holds on to trauma and other mental health issues. Welcome, Manisha.
Thank you so much for having me. It's a pleasure to be here.
I'm so glad you're here today. Thank you. All the way from Chicago. Has winter disappeared for you there?
Somewhat, but Chicago likes to play little weather tricks on us. So it'll be
right.
80 one day and 29 the next, and we just kind of roll with it.
You ride with it. I know. So if we could start with your professional arc, tell us why psychology?
I came to psychology very early on in my life. I think I didn't know it then, but I grew up with an aunt who was diagnosed with Down syndrome and also had some other issues around her mental health. And she lived in India, which is part of where I grew up a little bit as well. And I would sit with her in this room where she would have these sort of fantastical moments of, we were like sort of an audience where we would be watching her dance and do all these. She had this really lively life, just a lot. And she was very beloved to me. And I would always say to her, even when I was itty bitty, like, I want to understand your world and I want to be in your world. So my Aunt Nishu is the reason, Nishu Bua, as we say in my culture, is the reason why I really got interested in mental health and psychology.
Bear with me, I might be stretching it, but what you're describing is a woman who had this, in a way, an imaginary world. And was, the way you describe her, she sounds so childlike in the most wonderful of ways. And so even as a young person, you realize that was a world that embodied a way of being that appealed to you.
Yeah.
And yet as an adult, you're describing it as a kind of form of mental illness, which is such an interesting parallel, isn't it? Kind of childlike thinking and mental illness can be very aligned.
Right.
Yeah. Interesting.
Yeah.
Well, you just explained, because on your website you talk about how you're fluent in Hindu and Urdu. So I guess if you grew up in India, this explains why you know these languages.
Right. Yes.
Yeah. When did you come to the States?
That's a longer story, but let's just say I went back and forth, but officially moved here in 1990. But I lived in Canada and the United States as a child and did some of my elementary school and high school and college in India, and came here in the early 1990, actually, to be exact. And I've been here since.
So since we're talking about culture and trauma, I have to ask, pursuing a field or a specialty in psychology an acceptable goal for a woman in your culture?
I come from a pretty educated family. My dad was a civil engineering professor. A lot of my aunts had their doctorates. For my personal culture, it was accepted and also encouraged that I not rely on a partner for my financial and emotional needs. So I appreciated that. Coupled with that, though, was a lot of inherent sort of patriarchy and sexism. I had both, if that makes sense. You must get this degree and you must also, get married to a man. And I mean, I identify as more heteronormative, so that wasn't an issue, but like all of those things. Yeah.
Right, right. It reminds me, my parents used to say, you can be anything you want to be,
Yeah.
but let's have you be seen more than heard. And so there was this
Right.
dichotomy during
Yeah.
that time that was awfully confusing to me, but it was so much a product of where they came from
Right.
and their
Right.
upbringing, particularly from my mom.
Yeah.
So there's so many different modalities in psychology, so many
Yeah.
different approaches towards healing. How did you come across your kind of mixture, if you will, your
Yeah.
brew that you use in your everyday work?
I think that's a great question, Amy. What I realize is that Western psychology, as wonderful and commendable as it is, wasn't addressing the needs of a lot of us who grew up in whether it was a different cultural context or whether it was just not hearing about brown and black folks in the books that I learned in graduate school really made me explore like what are some other ways of conceptualizing my clients and also my own life that made sense to me. And so that's sort of where my smorgasbord of therapeutic sort of interventions experiences. And I always like to take my own take and sort of a decolonized approach to how I view people, because when I was in grad school, and many people can attest to this, we were taught to have like a blank slate to work with. Well, the people that I work with, particularly the immigrant community and a lot of people who identify as people of color, that's not necessarily what they're looking for. They want to connect with a different sort of lens. And so I had to recalibrate myself to sort of meet their needs.
Aligned with that is our proclivity to put everyone who looks the same in the same pile.
Yes.
So, how do you learn about the cultural nuances of your clients? Do you actually ask? Is that a part of the intake, if you will, or is that something that kind of unravels over the course of sessions?
I think the answer to that is it depends. Some people
Mm,
seek me out specifically because they might read my website, they might read a blog about something, and then they want to meet me and sort of get a sense of who I am. My initial goal with any client, because I work with so much trauma, is emotional safety. So
mm,
if it is to identify, like, how is it for you to be with me? For example, I'll be very transparent. I've been privileged enough that a lot of people from the Black community trust me, but I always ask them, like, how is it for you to work with someone who comes from a group of people who may have engaged in anti-Blackness? And how does that feel for you? And I've never had a client say, I can't believe you asked me that. They're always like, oh, wow. So it's a little disarming for them. So I hope I
yeah.
answered your question. Yeah.
Yeah, you did. You did. So I was thinking about how it's so easy for us to, I guess, whitewash
Mhm.
cultural, other cultural norms.
Yeah.
So, for example, I had a woman, this was a few years ago, who came into my office. She was in her mid 30s. She was from sub Sahara Africa, and she had had genital mutilation.
Mm-hmm.
And I knew how to deal with it from a physical point of view. I was able to
Mm.
help her with some,
Right, right.
adverse sequelae. But
Mhm.
I didn't necessarily know how to address it from an emotional point of view
Mm.
because this is something that's completely societally accepted in her
Yeah,
culture. So I
right.
didn't want to come off as, oh, this, all-knowing white
Mhm.
woman
Right,
saying
right.
this is wrong. at the same time, I wanted to help her through it. I sent her to a therapist who was very sensitive to it, but
Yeah.
I realized my own limitations on how do I address it given my own bias, I guess.
Yeah.
Yeah.
Yeah. Yeah. I always err on the side of just asking the person and seeing how they conceptualize or how they've made sense of this cultural norm, whatever it may
Mm,
be, right? And sort of understanding what if it's genital mutilation, like how did that impact you? How did your life change as a result of it? What would have been different had that not been a part of your history? So I think sometimes that answers a lot of sort of questions for me as well.
that's so helpful for those listening. It's really about kind of putting aside, in a way, your own questions, asking the person to answer the questions from her own perspective. Am I
Right,
being
right.
clear? Like, just,
Absolutely.
yeah,
What
that's
is
so
their
helpful.
subjective and lived experience of a
Right.
situation? Because we may make assumptions about it, but we have no idea.
Yeah.
There's no way that I could possibly know what's going on in the minds of so many of the people unless they share.
Yeah. Yeah. The other patient I had, again, this was some years ago, was a Native American woman
Mm,
indigenous woman from actually the mid part of the country, who had
mm,
left her community because of domestic violence.
mm,
And she was really feeling a great deal of betrayal from her
mm.
community because when she left, she was really ostracized. She was even further marginalized. But she realized that if she didn't leave, she might be killed. And
Yeah,
so I guess I wanted to talk about that group of people who's
yeah.
really feeling like they don't even have their own community
Right,
to
right.
trust. And this happens
Yeah.
particularly for women, right?
Yeah, absolutely. Absolutely. And sometimes how do I say this? Sometimes we accept things as cultural, even though harm is being caused. And we have to really
Mm,
check ourselves too. Like, there are people who really still struggle with issues that are happening in their culture or in the community in which they raise that are messed up, right? And we can't just put our sort of Western lens on that and say, oh, well, whatever. But for this person to leave and what that was like for them to have to leave that and then build their own community, that must have taken a lot of courage for them as
yeah,
well.
yeah. She was very brave, but she was so
Yeah,
sad. She
of
was so sad because
course.
she felt that part of what was so hard was not just leaving physically the community
Yeah,
that she grew up in and loved, but she, in a way, had to leave some of that cultural
yeah,
identification behind as well.
yeah.
Yeah. And so
Yeah.
you're adding not only the trauma of the
Mhm.
violence, but the grief of letting go of
Yeah,
so much of the context in which that occurred.
right.
Yeah,
Yeah.
and that's so often true for the women I meet. Yeah.
Yeah. Yeah,
Yeah.
for sure.
So one of the things I think about as a healer in the allopathic community, and I've
Mm.
always been interested in kind of the history of healing,
Mhm.
is that I'll meet some women who are from different cultures, and I might ask them, if you were to go back home in your culture, how might they deal with, let's just say, a headache? And they might say, well, there's certain dances that we do, or music we
Mm.
listen to, or
Mhm.
certain
Mhm.
prayers that we do. And I love learning about these kind of cultural, traditional ceremonies and communal
Mm.
support. Does that come into play when you're talking to your clients, and do you interface with that at all?
Absolutely. As somebody who really tries to understand sort of my client's worldview, I always ask them, like, when you were growing up in your family and things were hard, one of the things I ask is, who did you trust?
Mm,
And who were the people that were rooting for you? And also, when things were really bad, what did you do in your family system? And if it's not your family system, it could be your chosen family. How did you find yourself in those type of situations, and how did you survive those
mm,
situations?
mm. Great. Yeah. So you're clearly a person who's deeply steeped in this empathy,
Yes.
and I admire that.
Thank you.
In preparation for today's conversation, I was reading about cultural humility, and I had not
Mm,
heard that term
mm,
before. And so for those listening, it's about providers of all sorts acknowledging their own bias and focusing on the client's cultural background to build trust. And I realized how, Manisha, how little this was, well, not only little, this was never discussed in the world of
Mm,
allopathic medicine.
yeah, yeah.
I'm wondering, are you aware of your younger colleagues, whether this is being communicated in the training programs? Is this something that's being
Yeah,
talked about?
it's mandated, and it was mandated when I was in grad school 30 years ago. I went to a very sort of radical program where we had to actually sit down and identify our biases because the program very much felt like we are creating damage if we can't, check our shit at the door, right? And I feel like having taught diversity now in grad school, different grad schools, I feel like it's very much a part of the curriculum now in psychology. I can't speak to all other. So yes, cultural humility is something that is very much interweaved. Do people always practice it? Not necessarily, but at
If
least if an
only.
effort, right? If there was
Right.
an effort, yeah, made for sure.
I don't know whether this is being communicated in medical school now. I really don't know.
Mm,
But, doctors didn't have shit in my day.
right.
The
Yeah.
first day of my medical school, the dean proclaimed us godlike.
Oh gosh.
Yeah. So there was no room for flaws or,
Right.
well, and our bias was, I guess, hierarchically
Yeah.
appropriate.
Yeah.
Yeah. Really a shame. So, I mean, I see it all the time. We
Right.
certainly know in the world of OBGYN, it's not
Yeah.
just about access, but that there's still so much racism against women of color in the world of
Yeah.
OBGYN. And we see it, unfortunately, in so
Yeah.
many metrics. Yeah.
Right. Right. For sure.
So, in a time where in this country, DEI is being suppressed,
Yeah.
what are some ways in which you would encourage listeners to think about their own bias and biases?
Yeah. Yeah. I think that's a wonderful question. One of the things that I recommend, and I've done it myself, so I practice what I preach, is for people to go to, I think it's the unconscious bias. Harvard did a study, it's like implicit bias. And you take all these tests, and they're like, it's phenomenal. I was shocked. I thought I was such a feminist, and saw like I had to check myself, but like
Hmm.
that's one of the ways. But also, how do you build community with people who are different than you, right? And sit at the same table to have these really profound, and if not profound, just conversations of curiosity and care. And I think what has happened, what I struggle with is that, and maybe this is a cultural thing here in the United States, I feel like people are too careful and they don't want to talk about what is it like for me to sit in front of you as a brown woman being interviewed by you and pretend that we're at a gathering. And that's the same thing. Like, can you have curiosity about me? And can I have curiosity about you? And will that curiosity help us build community and safety and care? And all those things, we don't need to even slap labels. That's how we show up. We show up authentically, but also with abundance and, yeah, curiosity.
It's so paradoxical for me because I would also say not only is there so much pressure for political correctness that it
Yeah.
keeps people from being curious and
Yes.
honest about their
Right.
fears and thoughts and biases. But
Yeah.
there's also aligned with that is what I'm experiencing is this lack of just common courtesy
Yeah.
and kindness.
Yeah.
And I'm not talking about a level of politeness that keeps you from having a conversation with somebody. No, it's
Yeah.
about just saying, I'm going to respect that person as a human being. How do
Right.
I say please and thank you? How do I just be kind?
Right.
So there's a lot happening in
Yeah.
the cultural zeitgeist right now that's
Yeah.
keeping us from being in the same room with folks. And
Right.
it's so unfortunate because then we just get deeper and deeper into our own kind of silo
Yes.
and don't have the opportunity to open the windows.
Right. Right.
Yeah.
Beautiful
Yeah.
way to put it. Thank you.
Yeah. So one of the things that's also on your website and is spoken about a great deal, but I wonder if the audience doesn't really know what trauma-informed care is. Can you
Yeah.
define that for us, please?
Sure. Trauma-informed care is really understanding the person in the context of what their life experiences are, what the sort of distressing events in their lives have sort of brought them to this point in their lives, whether it's in therapy, whether it's with a medical provider, wherever. And so when we're talking about trauma-informed care, we're really talking about just understanding the person in the context in what they experience. So I think Bruce Perry puts it in a beautiful way of like what's happened to you versus like, you know, something that you've done wrong. Because sometimes what happens when people have their life experiences, there's a lot of internalization that happens when they've experienced trauma. I'm bad. It must be my fault. I'm not good enough. All those negative cognitions that people carry. And trauma informed care really puts the client, the patient at the forefront in terms of, well, this is how you got here. This is the cultural
Mm,
context in which you arrived. And I think
mm.
it's a beautiful way to sort of look at a client and really understand their worldview.
And I'm assuming that you take on this approach with anyone who might walk into your room because we don't
Anyone,
know. I mean, I don't know that there's any human being who hasn't experienced trauma.
of
Now, the
course.
level of trauma is obviously a
Right.
range,
Mm-hmm.
but regardless of the trauma, it affects the individual. So what I'm hearing you say is basically whomever walks into the room, we're going to assume that there's been trauma and we're going
Yeah.
to assume that there's been some internalization that maybe I brought it on myself or maybe I caused it or I'm bad as a result of it. And instead changing the narrative to this happened to you. Where
Yes.
does it leave you? Yeah. Oh,
Yes.
that's great. That's great. It's so interesting to me, and bear with me. I think I'm revealing my age here, which I'm very proud of. But when I was kind of growing up, when I was early in my career, trauma, literally the word trauma,
Mm,
was rarely used. And I've mentioned
right.
this on Gyna Curious before because
Mm,
I'm still curious about it. Now trauma is a
yeah.
word, a diagnosis, an event
Right.
that like everyone's talking about.
Yeah.
And I'm not bringing it up to diminish or belittle it, not at
Yeah.
all, but it is a curious shift in
Yes.
the lexicon. It just didn't exist. Do you have any insight into what's helped make that shift or why or just anything you could say about that?
Yeah, for sure. I will say that sometimes it's overused. So, because sometimes people will be like, I have major trauma that missed a bus or something like that. I said that's not, or missed a train or whatever. That sort of diminishes what people who, I mean, again, everybody's perspective is different. But to answer your question, I feel like accessibility, and I think that this is not necessarily a good thing. Social media has really created a lot more visibility to these concepts. I would say to the detriment at times for people
Mm,
who are consumers, because I see this with my clients sometimes too, where they get so focused on the Instagram therapist or physician or influencer, and they sort of follow that versus someone who has experience, who knows that person. But the positives are accessibility to mental health. I think that that's
mm,
really, and sort of people are more comfortable. Like I do some organizing and I'm around a lot of young people and everybody's in therapy and everybody openly talks about it. And they'll tell me, well, my therapist did EMDR with me, or my therapist did this with me. And so I love that because I think that it's wonderful that people can access therapy. I understand why the popularity of the word trauma exists right now, because I think that my generation, which I'm sure we're very close enough in age, we didn't talk about these kind of things. We weren't allowed to talk about these things. And if we talked about it, we had to put on our big girl pants and just move through it, right?
You bet. You
And
bet.
and I'm raising a young woman right now, and it's a whole different, I'm a young woman and a young man, and it's very different with them.
It is. It is. Yeah, it leads me to a conversation I've had with so many of my friends around. I love that my kids and their cohort are open about their
Mm,
depression, their anxiety, their fears.
mm,
I love that.
mm.
In contrast to the incredible repression of
Yeah, yeah,
generations before me.
yeah,
But sometimes as you describe, pulling up your big girl pants, I wonder whether there's been a loss of a certain amount of, the word I use is grit.
yeah,
Like, like, come on, you missed the
yeah,
bus? Really?
yeah,
That's just
right,
not trauma.
right,
And
right.
yet I want to be respectful of their perspective, but there's this,
Yeah,
it's an interesting slippery slope. You're right. As trauma, the word is
yeah,
overutilized,
yeah,
then how much is it misused
right,
in contrast to it allowing a certain amount of
right,
open air conversation, which is
yeah,
always good.
yeah,
Yeah, it's interesting. So I want to pivot a little bit. So as a
sure,
gynecologist, I work a lot in the body
yeah,
and organ systems. And when
right,
I
right.
think about pathology, I think about the body and organ
Mhm,
systems. I happen to be particularly interested in the mind as
mhm.
well, but you work in the mind.
Yeah,
Yet you have said again in your bio that you really think about the mind body connection. Can you
absolutely.
talk about that, please?
Yes, absolutely. I think that when I look back at my training in graduate school, we didn't really talk about the body. And as a seasoned clinician now, I'm like, how the heck did we talk about the body? Like, our body is so important. They're interconnected, they're not separate. So,
I like to say
what,
we have a neck for a reason.
right, exactly. So, I feel like as someone who practices somatic therapy, which is a body centered healing approach, it allows people to actually not just tell their stories, but also release some of the trauma that does exist in their body as a result of pushing down, whether their stories, their lived experiences, and whatnot. And so when I'm practicing somatic therapy, it really helps them release that chronic stress and reconnect with their bodies in a very significant and real way.
When you say somatic therapy, can you kind of very briefly say
Sure.
like
Yeah.
what goes on in the clinical settings
Yeah.
that
Yeah.
sets it apart from something else,
Yeah.
different approach?
So sometimes in somatic therapy, well, one of the things we do is like grounding people. So say that you're coming in from outside or in my case I do telehealth, and people just had a rough phone call with their partner or employer or whatnot. The first thing I will do is ask them to just think of them as having arrived in this moment,
Mm,
and what that feels to ground themselves in this moment, right? And then another thing that we do is when tough stories are being talked about, I'm tracking it and I'm helping the client track their body sensations and their breath. So, one of the things is sometimes when people are holding a lot of stress or trauma, their tongue tends to be at the roof of their mouth. So, I will say to them, let's relax your tongue a little bit and allow yourself to sort of have a more curious stance toward whatever it is that you're sharing with me. So, those are just some of the tools, but there's so many of other tools that one of my favorite is when somebody's telling a story that, and I say to clients, I don't need to hear the whole story. I just need to hear maybe a headline of what it is. So it could be young woman walking down the street, gets assaulted and feels like it's her fault. That's a headline. I don't need to know the whole story because sometimes the whole story is too dysregulating for their nervous system. So
mm, mm.
body centered therapy is really about regulating somebody's nervous system. And there's different techniques in how to do that.
Yeah. what I've observed and practiced and experienced within my own body, but
Yeah.
particularly as the clinician in the room, is particularly as you said, after doing this for decades,
Yeah.
a woman could walk into the room and I mean, I can tell kind of what their day was like as they're walking down the hall,
Right. Right.
right? That
Yeah.
there's so much emotional, psychological information that's being
Yeah.
expressed just through the body without any verbal
Right.
communication, right?
Absolutely.
And so to
Absolutely.
be able to honor that, and I mean, all of
Hmm.
us have experienced it. I don't know about you, but if I'm anxious or depressed, I feel it in my neck. I feel it in my gut.
Absolutely.
I breathe less deeply, all
Mm.
those things. So when somebody can point that out to me and say, okay, Amy,
Yeah.
take a deep breath. I mean, I've interviewed
Yeah.
several people now on Gyno Curious about just breath work and how
Right.
that brings us to our parasympathetics and just allows us to slow the fuck down.
Absolutely.
I mean,
Absolutely.
we're just particularly women, we're running
Right.
around ragged,
Yeah. Yeah.
ragged, ragged, ragged. So I was looking up some data. I like data.
Data's nice. Yeah.
Yep. According to a 2025 US government census, which is probably an underestimation given what's going on in this
Mm.
country right now, nearly 40% of Americans identify as a member of a racial or ethnic minority group.
Hmm.
I I was surprised, and I didn't know
Mm.
whether I was surprised because I was a kind of deaf, dumb, and blind white girl,
Mm.
or was I surprised because maybe where I live, or was I
Mm.
just surprised because these numbers were I just didn't know.
Mm.
And it struck me particularly interesting in relation to racial trauma.
Yeah. Yeah. Yeah.
And it made me really sad because I thought, oh my gosh, if there's
Mm.
such a large cohort of people, now 40% is probably male identified and female identified
Mm.
persons, but
Mm-hmm.
let's just say it's even just 21% of that
Right.
40% who identify as female, who, are in a racial or ethnic minority. And if in fact being a part of a racial minority is an increased risk for trauma,
Yeah. Yeah.
there's
It's
a
a lot.
lot going on. There's a
It's a
lot
lot
going
going
on.
on. Yeah.
And, so you're a woman. Okay, that's one ism against you. Then
Yeah.
there's the racial tensions, another
Yeah.
ism, and then
Mhm.
again, the cultural milieu in which this country is trying to
Yeah.
homogenize.
Absolutely. Absolutely.
How do you, as a woman of color, as a
Mm-hmm.
woman who's receiving so many stories about trauma, how do you hold on to this? Or how do you let it go so that you can get
Mm-hmm.
home to your two kids
Mm.
and not be mired in the sadness that I just alluded to? Because
Yeah.
again, it's sad. And
Yeah.
I just wondered how you deal with it on a professional slash personal level.
Yeah. I think that's a really good question. I work with a lot of serious, challenging people. And one of the things that I've learned is, and I don't know how I've done it because it is a work in progress, and I'm a work in progress, is
Aren't we
really,
all?
yeah, is how do I engage in my own self-care and my own healing and my own consultation therapy. I live in Chicago and it might even be like -40 wind chill. I will put on my freaking hat and gloves and I will walk every day. And that's my form of self-care, right? And unless it's pouring rain, I won't, but otherwise. And that's been really healing. And then community and books. I'm a perpetual reader and I love curiosity. And so all of those things, like just a really I don't want to say regimented, but like really good self-care, knowing that that's a privilege, that I have the privilege to engage in self-care. Not everybody does, but I do. And really, and then honing in on community. And one of the things that I really in recent years have enjoyed is doing stuff that's not psychology related, because if you've been around a bunch of therapists, sometimes we can be a little insufferable. And so really other things that, and they're amazing, all my
I
besties
hear
are,
you. I hear you.
but you know what I mean? Like any community that's homogenous in that way, really taking some space, but also laughter. Laughter is so important. And after a rough day, sometimes I'll just watch, comedy or something lighthearted. So those are some of the ways. But I mean, community and care and self-care all are all of the ways that I take care of myself.
Thank you. It's remarkable the number of women, guests whom I speak to, who getting outdoors
Yeah.
is their secret, if you will.
Yeah.
It's the formula for well-being, even
Yeah.
if it's just a brief moment out in the
Yeah.
sun. It's just
Yeah.
so healing. So we're
Yeah.
moving towards the end of our show, and I wanted to
Sure.
make sure you mentioned that again in your bio that you take care of pregnant women and
Yeah.
that this is a cohort that is of particular interest to you. And I guess I want to ask why and what makes them different or interesting to you.
Yeah. So I'll share a tiny little history piece and then I'll tell
Please.
you why. So I was born in India and my mom was living in a joint family, which is a system that used to exist and still exists in India, where multi-generational people live together. So it could be two brothers, it could be parents, whatever. Okay. So my mom was pregnant with me. I was the firstborn and her water broke and she had no idea that her water broke. I don't know how disconnected she was from her body, what was going on. And basically, it got to a point where one day, one of the elders in the family said, "Hey, your due date was like, I don't know how many weeks ago. What's going on?" And that's how I came into the world, barely gasping, emergency
Mm,
C-section. And at that time, it was like, it wasn't
a
like,
vertical incision.
right. I was brought into the world under very serious circumstances. And it was serious for her too, as the person who was delivering me.
Yeah.
So that's a little history piece. And then what I realized working with a lot of women, particularly whether it's immigrant women or women of color or just women, pregnant people in general, sometimes, especially when you've experienced trauma, a lot of people ignore their physical needs and they're so attuned to the needs of other people that pregnancy is a time when it's really important to be attuned to yourself because you're growing a baby inside of you, right? And so that's kind of where my interest lies. And also, when I was pregnant, I was told by the attending that they couldn't find my cervix, and not the attending, the medical student. And they kept saying, "Well, you don't have a cervix. You don't have a cervix." And I was like, what is this person talking about? Like, do you know what I mean? So advocacy. And so I had to be like, of course I have a cervix, right? And this is me as an educated person with a
Right,
doctorate
right,
degree.
right.
And what I've noticed is so many women, unfortunately, they're silenced or ignored. And a lot of them feel that way. And I want to mention one more thing because I think it's really relevant. I work with so many Black women who have had horror stories, and there's no mystery that the mortality rate is so high for pregnant Black women. And why? Because they don't feel like their providers are hearing them, or the pain threshold might be different. So, all of that, all of those things make me very interested in just advocating and helping my clients advocate for themselves, particularly when they're pregnant.
Yeah, women and women's bodies have been gaslighted for centuries,
Yeah,
and there's so much generational trauma around
yeah,
that, historical trauma around that, and
yeah,
ongoing trauma
yeah,
around that. And we could have a whole nother show, and actually, I'm kind
yeah,
of curious, maybe we will, about
yeah,
pregnancy and the
yeah,
traumas associated with it. And I could speak to my own experiences.
yeah,
And I'm so grateful to you that you're
yeah,
doing that work because it is interestingly enough, a lot of women get pregnant, but
yeah,
very few women have access to talking about the psychological impact of well, trying to get pregnant, if that's hard, being pregnant, which is hard,
Yeah.
and then postpartum. And
Yeah.
what happens to our world when all of a sudden we're taking care of this, baby who needs our full attention?
Yeah.
And, where are we in that arena?
Absolutely.
Where are we in processing? There's no
Yeah.
time to process the
Right.
emergency C-section. There's no time to process
Right.
the fact that our partner left the room. All these
Absolutely.
things. Yeah.
Absolutely. So really
Yeah.
helping people who are pregnant to have agency and to
Yes.
really
Yes.
also heal from different aspects of, yeah.
Yeah. Great. Great. So I like to end the show by asking you about pleasure.
Yeah.
And I think us women need to talk about pleasure more and
Yeah.
more and out loud. So
Mm.
when you have a moment to yourself or with others,
Mm.
tell us one thing that gives you great pleasure, joy in your life.
Laughing with my loved ones over
Yay.
silly, innocuous things and
Yay.
laughing to the point where I peed my pants. That brings me so much joy, so much joy.
I love
And
that. I
just,
love that. That's like the laughter metric.
yeah, and just grasping moments, just simple moments, just,
Mm.
slowing it down
Mm.
and grasping simple moments. And, you know, spring is blooming, a bud, a flower, like all of those things. I saw daffodils and I just was like, oh, so those are the things that give me a lot of pleasure.
Thank you. Thank you. Thank you. So I hope the spring blossoms are abundant around you.
Thank you so much.
And thank you for sharing your expertise and your wisdom with us today.
It's my absolute pleasure to be here. I appreciate
If
it.
someone is interested in pursuing care with you, Manisha, what is the best way for someone perhaps to find out about you and access you?
Sure, they can go to my website. It's www.creatingconnectionspc.com.
Great, great, wonderful. Thank you to Jen Hammoud and Maddie Rosenberg, my co-producers. Thank you to the Epicurean who so kindly has Radio Free Rhinecliff in its wonderful four walls. Thank you to David Hoffman, my editor, and to all of you listening. Please stay well. Continue to listen to your instincts and intuitions. They are the greatest of teachers, not to be ignored.